Colleagues, welcome back to our debates, and we will continue with the speakers list. Greece first, and then Germany. Greece, then Germany.
Thank you. Honorable Chair and colleagues, I would like to congratulate the government of Israel for the excellent organization of this conference. And special warm congratulations to the First Lady of Israel, who officially expressed her support to the WHO and inspiring Dr. Kluge on the mental health issues of the region that are of major importance in these unprecedented times. Greece has been working closely with WHO Europe and especially Dr. Kluge, creating new policies and strategies for the strengthening of mental health services with special care for the vulnerable groups in order to leave no one behind. Recently, we inaugurated the new WHO office in Athens on quality of care and patient safety that now operates a new program on mental health services for children and adolescents in the region. Special thanks and congratulations to Dr. Kluge and the Secretariat for the important topics of this conference with emphasis on digital tools and BCI resolution. Greece fully aligns itself with the statement made by Czechia on behalf of the European Union and thanks the WHO Regional Office for putting high in the agenda the importance of BCI in the fight against serious global public health issues, including the COVID-19 pandemic in our region. The COVID-19 pandemic has shown beyond doubt the critical role which behaviors and their cultural contexts play in a public health response and in creating feasible, effective, and equitable health policies, procedures, and recommendations. Building on the BCI unit's COVID-19 BI survey tool and guidance, Greece was amongst the first European member states to develop a nationwide survey during the lockdown period in April 2020. The result from this survey helped to adjust COVID-19 information campaigns and provide more targeted health messaging. Greece has also been working closely with the BCI unit to pilot WHO's evaluation framework for complex BCI interventions. Our country has been committed to shaping both the BCI draft resolution and the BCI regional action framework through the active participation of its BCI national focal points. The adoption of the BCI resolution and framework will mark the beginning of a collaborative journey with member states and the WHO Europe Secretariat to better understand the health and well-being needs of our populations. Thank you very much.
Merci la Grèce.
Thank you, Greece. The floor goes to Germany, followed by Finland. Germany, have the floor.
Sehr geehrte Frau Vorsitzende, sehr geehrte
Madam President, Regional Director, colleagues, Germany subscribes the EU's statement. The COVID-19 pandemic has shown us that we must change our behavior in order to protect our health. We need to work together to establish health measures to ensure that people find it easier to protect their health. In Germany, reinforcing healthcare competence within the population has been a crucial task. Germany has a long tradition of observing prevalence and social determinants in healthcare outcomes along population groups. And we need to explain what these are. The necessary measures have been put in place, and communication campaigns that went alongside helped. Support by public media have helped us a lot as well. We received help from communications campaign with social networks. This allowed us to better understand the extent to which we could contain the spread of coronavirus and mitigate waves. Vaccine campaigns were adjusted as we went along, and the number of vaccinations last year went down, which led to an increase of data on this issue. We realized that people wanted to be vaccinated in all sorts of different places, and we made this possible in pharmacies as well. And we gave information in many languages. To improve the use of data, Germany established and will establish in the future new structures in order to increase behavior data, in order to make systematic assessments. Healthcare policy must take into consideration human behavior, and we must adjust these behaviors. And therefore Germany welcomes the fact that it has new data to improve behavioral sciences, to improve people's health. Finland, then Denmark.
Merci pour d'avoir me donné la parole. Merci. Vous pouvez m'entendre?
Thank you for giving me the floor. Can you hear me?
The statement of the EU and its member states. Behavior and cultural insight have a long history in Finland. They can be traced to the North Karelia project launched 50 years ago. Through evidence-based individual and community-level policy measures, premature cardiovascular mortality was reduced by 80%. The North Karelia project laid the foundation for successful application of BCI among diverse populations, including socially disadvantaged and vulnerable populations. COVID-19 has highlighted the importance of effective crisis communications. We need to consider populations' cultural diversity in policy measures. Finland recently established a Center for Cultural, Behavioral and Media Insights to develop effective and sustainable practices for public health and well-being. Finland emphasizes three matters. First, behavior is shaped both by individual and contextual factors. Individuals' responsibility of their own health is being increasingly stressed. However, many health determinants are beyond the direct influence of individuals. People may have limited resources for making informed choices. Policies and environments have a major impact on equity in health. Monitoring health determinants and addressing risk factors is essential. Second, it is important to acknowledge the increasing cultural diversity of populations. Consideration of culture in designing health promotion measures is key to reaching the desired behavior goals. It is important for building social cohesion and societal security. Third, today internet and social media open new communication channels for health authorities. To capitalize on the opportunities of the new communication channels and to promote health equity, we need to counter mis- and disinformation and promote health literacy. Health communications should be developed based on social evidence base. Thank you very much.
Merci.
Thank you, Finland. The floor now goes to Serbia, followed by Portugal and then the United Kingdom. Serbia, you have the floor.
Good afternoon, ladies and gentlemen, dear colleagues. I am very pleased to be today with you and to have opportunity to discuss our success in using powerful tools such as behavioral insight surveys. From the very beginning of the COVID-19 pandemic, Ministry of Health of Serbia recognized the importance of social listening and needs to get more familiar with information and needs of our citizens when it comes to the new virus. This was even more important when first vaccine became available, since Serbia was one of the first countries that started with COVID-19 vaccine at the early stage. With WHO support, we implemented 6 waves of behavioral insight surveys that helped us to gain the insights as well to understand the factors that affect health-related behaviors. The results has been used to improve the health-related outcomes by developing and improving interventions and making them more effective, inclusive, and people-centered. In addition, we use this knowledge for preparation of the 2 additional waves of surveys targeting population with lowest vaccination uptake in Serbia, which helped us to frame the outreach work at the field that improve willingness and intention of COVID-19 vaccination. Looking in this 2 years period, we have been able to see also longitudinal impact changes policies and communication make when it comes to health-related behavior. So behavioral insight studies are also used as additional evaluation tool promoting importance of science and developing, improving and evaluating interventions in Serbia. Knowing how powerful tool is, we are planning to use it for some other investigation that require knowledge of different risk factors and consequent behavioral change in population. For example, for non-communicable diseases that represent highest burden of morbidity and mortality in Serbia. We will continue our fruitful collaboration with WHO through our Institute of Public Health of Serbia and nominated focal point for behavioral surveys. We will also try to establish country coordination mechanism for these interventions in future. Thank you for attention.
Merci la Serbie.
Thank you, Serbia. The floor goes to Portugal, followed by the UK and Turkey. Portugal, you have the floor.
Mr. Regional Director, Mr. President of the Regional Committee, distinguished colleagues, Portugal has been a strong supporter of behavioral and cultural insights, BCI, since the introduction of this flagship activity in the European Programme of Work 2020-2025. A better understanding of the barriers and drivers which people experience in leading healthy lives is a critical prerequisite to creating better health interventions, more efficient health systems, and of course, more effective health policies. The pandemic has shown the need to better understand individual behaviors and the cultural context of our societies. However, BCI is also critically important beyond COVID-19. An embedded and well-supported BCI approach can add value to all areas of health and even beyond, whether it's improving hospital care, supporting climate action, or tackling poverty. Portugal has been using BCI together with health literacy tools for several years. To support the COVID-19 response, for instance, Portugal initiated a micro-influencers project which built on behavioral and cultural insights to improve health literacy around COVID-19, engaging the community and organizational leaders as key partners to make public health, social measures and vaccination understandable and acceptable. The high vaccination rates speak for itself. Working together with WHO's BCI unit, this project is now undergoing a rigorous evaluation process to not only determine its impact and reducing misinformation and increasing public health compliance, but also to understand its impact on relation to building trust, social cohesion, well-being and health equity in Portugal. As referred over many years, Portugal has been particularly committed to the area of health literacy, a critical component of WHO Europe's BCI approach. It has been leading by example, building on the National Health Literacy Plan by including a strong focus on behavioral insights and supporting WHO's work through active engagement in the Member States' networks, platforms and joint projects, such as the evaluation of the social mobilization activities in the context of the pandemic. We congratulate WHO for the BCI action plan and for its creation process, which has been a truly participatory one. Through its national focal points, Portugal has taken full advantage of helping to shape it. The action plan is comprehensive while still being able to be achievable for the Member States, regardless of their level of experience with these tools. Thank you.
Merci.
Thank you for Portugal. The floor now goes to the UK, followed by Turkey and Israel. The UK have the floor.
Thank you, Chair. Applying behavioural and cultural insights, or BCI, is critical for achieving the Sustainable Development Goals, tackling poverty and promoting economic equality. Through systematic engagement, active listening, segmenting and tailoring interventions to the particular barriers experienced by specific population groups, BCI is an effective tool for reducing health inequalities. BCI recognises that making healthy choices and living healthy lives are shaped by a variety of factors, and that improving the health and well-being of citizens is a shared responsibility between individuals as well as governments, institutions, civil society and health providers. The UK is pleased that as a region we are increasingly scaling up the application and integration of work on BCI to strengthen our health-related policies, services and communication processes, and note that more national and local health-related strategies and action plans are referencing the use of BCI as an effective response to key health challenges. As we heard from David earlier, the UK was one of the first countries globally to have a dedicated behavioural insights team embedded within government, and we now have a national strategy. That strategy states that behavioural science is crucial to the understanding of public health problems, and that the application of that behavioural science evidence and data is crucial both to make sure that our policies and interventions are maximally effective, but also that they are efficient and equitable. Behavioural sciences is ultimately a flexible tool that can be applied to a large number of areas of public health, many of which have been touched on by the presentations and videos at the start of this session, including infectious diseases and AMR, health service-seeking behaviours, sexual and reproductive health and rights and gender equality, as well as water, sanitation and hygiene. The UK welcomes this opportunity we've had today to share our experiences of BCI between member states and are committed to continue our international collaboration on this issue. We would also like to be noted as a co-sponsor of this resolution. Thank you.
Merci.
Thank you, the UK. The floor now goes to Turkey, followed by Israel and then Austria. Turkey, you have the floor.
Thank you, Chair, distinguished delegates. Every country and its culture in the WHO European region are unique and diverse. It's a significant requirement to address these diversities to promote health and well-being of people in the misinfodemic era. In this context, we welcome one of the flagship initiatives of European EPW, an action framework for behavioral and cultural insights for health 2022-2027. It's critical to understand the concept in the same manner for all to proceed forward. As far as I can understand from the working document on regional action framework for BCI, BCI can be a tool for delivering better health and reducing inequalities. It's like another important approach to alleviate obstacles of social determinants of health by focusing social, behavioral and cultural differences to overcome barriers which drives people to risky or unacceptable practices because of their knowledge, traditions, or with the effects of infodemic. With this point of view, we're delighted to see such an initiative on the agenda, and we are ready to support that document enthusiastically. Although we are ready to support that framework, some examples of BCI initiatives confused us, and we think action plan may need much refined work to prevent misunderstandings before finalizing it. We are ready to support such an invaluable work which helps and guides us to a stronger health system to reduce inequalities. Thank you very much.
Merci la Turquie.
Thank you, Turkey. The floor now goes to Israel, followed by Austria and then Bulgaria. Israel, you have the floor.
Madam Chair, thank you for the opportunity to talk about BCI and the Israeli health system. We congratulate WHO Europe for its work in compiling this resolution and action framework, which we fully support. It is an important document which will lead to better utilization of health services and healthier behaviors. BCI is an important concept in healthcare. It recognizes that external factors shape the choices we make, and that by influencing these factors, we can achieve better healthcare behaviors and healthier lifestyles society-wide. COVID-19 highlighted the need for tailored approaches to different demographics and cultural contexts. Israel embedded a series of functions in its National COVID-19 Operations Center designed to shape outreach to minority groups on many issues, from vaccine rollout to social distancing and relief efforts. To make health services culturally and linguistically accessible, Israel deploys a liaison program, training minority community members to guide individuals toward fuller utilization of services. Over the past 5 years, Israel has assisted hundreds of thousands of individuals through these programs. We also employ an impressive number of multilingual medical practitioners, searchable by the languages they speak, and run a 24-hour translation service in Arabic, Amharic, Tigrinya, Russian, and more. Beyond linguistic and cultural considerations, Israel is proud to apply BCI frameworks in additional contexts. This includes nutritional labeling, taxes on sweet drinks, incentive structures for early detection screening and vaccination, as well as NCD management and prevention programs. This helps ensure that our services are not only accessible, but optimally utilized as well. Our new front-of-pack nutritional labeling has already resulted in a 33,000-ton reduction in junk food consumption. Our school programs on healthy diet and exercise have seen a 1.2% and 2.3% drop in obesity among first and seventh graders, respectively. This transforms children into health ambassadors to their families. Our incentives program help benchmark HMOs, encouraging them to apply BCI concepts to change patient behavior, bringing these tools to the heart of community care. We have implemented a hospital infection program with strengthened regulatory authority and established incentives and standard operating procedures that have brought down hospital infection-related deaths by 25%. Making the public health discussion more holistic is essential for any modern health system, and we look forward to international collaboration on this highly important matter. Thank you.
Merci.
Thank you very much, Israel. And I give the floor to Austria, followed by Bulgaria, and then Armenia. Austria, go ahead, please. You have the floor.
Vielen Dank.
Thank you very much, Madam President. Austria endorses the statement made by the EU and its member states that was delivered by Czechia. We are grateful for the document action framework for BCI. The aims of this action framework are in line with the Austrian focus on the determinants of health, and thus our focus is on the conditions under which people can adopt healthier behaviors. Now, the 8 principles of the action framework are implemented in the 10 Austrian health goals. The health goals pursue the approach known as health in all policies, and they focus on improving the health skills and competencies of the Austrian people. In Austria, the promotion of health and the prevention of disease is a difficult issue. All stakeholders do agree, however, that through strengthening these areas, we can move away from a curative approach to medicine and move towards a sustainable health policy. Nevertheless, our health system and the corresponding finance, nevertheless, are sick, so to speak. We're focused on treating illness and not prevention. In Austria, in early 2022, through my department, an agenda was adopted on health promotion, and here we focused on the promotion and creation of the Skills Centre. The Skills Centre helps to integrate health skills, health promotion and prevention as the core issue into a comprehensive health care program. Under the Ottawa Charter, inter alia, participation and the empowerment of all should be enabled, in addition to knowledge, motivation and skills of individuals. Moreover, alongside this individual component, we must also drive forward the further development of organizations within the health system, and indeed we must continue to improve the health system as a whole in order to specifically meet the needs of people and to live up to those needs. As the COVID-19 pandemic has shown, the communication of health measures is of great significance. Therefore, the Competence or Skills Centre, as well as the Austrian platform Health Skills, deals with awareness raising as well as with the framework conditions for this very important topic. Thank you very much. Thank you very much, Austria. I now give the floor to Bulgaria, followed by Armenia. Bulgaria, you have the floor. Please go ahead, Bulgaria.
Honorable Chair, distinguished Regional Director, Bulgaria aligns itself with the EU statement made by Czechia on behalf of the European Union member states. Bulgaria highly appreciates and supports the vision, strategic priorities and key principles enshrined in the proposed draft European Regional Framework for Action on Behavioral and Cultural Attitudes for Health as a basis for intensified efforts across the region to promote science and the use of behavioral and cultural attitudes for better health outcomes at international, national and local level. We welcome the guidelines for action in the presented document, and we are confident that the proposed draft regional framework will be useful and will serve as a starting point for deeper discussions on building and maintaining capacity for behavioral attitudes in the countries of the WHO European region. Our country supports the draft resolution to the document promoting the use of behavioral and cultural factors to identify opportunities for effective, adapted, fair, and people-centered health-related policies, services and communication that are more accessible, comfortable, acceptable, and context-appropriate. Bulgaria highly appreciates the proposed strategic document and will assist in its implementation according to the national context and competencies in the field of healthcare services delivery at the national level. Thank you for your attention.
Merci.
Thank you very much, Bulgaria. I now give the floor to Armenia. Armenia, please, go ahead.
Thank you. Honorable chairs, dear colleagues and friends, before I start my intervention on the topic, I would like to bring to your attention that today at midnight, Azerbaijan launched a large-scale military aggression in several directions from the eastern part of the Armenia-Azerbaijan border. The Azerbaijani armed forces started intensive shelling of the cities and villages of Armenia. As a result, there are 49 casualties on the Armenian side. They target civilians and civil infrastructure, including healthcare services and units. This recent unprovoked and unjustified aggression against the sovereign territory of Armenia is yet another flagrant violation by Azerbaijan of the Charter of United Nations and other international acts. The unilateral action of Azerbaijan constitutes a real threat to international peace and security and deserves a strong and timely reaction from the international community. And while we distinguished colleagues are sitting here discussing how to move forward to tackle the health challenges, Armenian soldiers and civilians are battling for their lives and lives of Armenian people. Dear colleagues, we, and I believe every country represented here, value each life of our citizens. Therefore, government of Armenia is and has always been resolutely dedicated to improving the health and well-being of all our citizens. Government's policy and the reform are implemented to increase the efficiency of management within the health sector, which are aimed at the prevention of the harmful effects of behavioral insights. We have established healthy life promotion programs, including in school, starting from primary grade, strengthening health and limiting unhealthy nutrition and other activities. In order to implement measures aimed at addressing the effects of behavioral and cultural factors in Armenia, we continue to implement surveys of the prevalence of certain behavioral factors which helped us to justify and adopt new tobacco legislation and initiate limiting the salt intake. In 2021, with the support of WHO, surveys were conducted among the population and healthcare workers to identify the behavioral and cultural attitudes regarding the implementation of COVID vaccinations. The results of surveys serve as a base for improving vaccination promotion programs. Dear colleagues, despite the ongoing aggression against Armenia, we remain committed to continue on the path by joining to the European Regional Action Framework for Behavioral and Cultural Insights for Health. I thank you.
Merci.
Thank you very much, Armenia. I have no member states wishing to take the floor on my list. Is that the case? Do any member states want to take the floor at this juncture? I see that that is not the case. Therefore, we will move on to partners and IGOs. I would like to give the floor to UNICEF, please. UNICEF, go ahead.
Thank you for the opportunity to contribute to this session. As the United Nations Agency for Children, UNICEF supports and promotes healthy and protective behaviors for children, like breastfeeding and immunization. UNICEF has been a leader in the field of social and behavioral change for over 35 years, with one of the largest behavioral workforce globally. Over the years, UNICEF work on communication for development has expanded to be more effective in triggering social and behavioral change. This allows to develop sound policies to promote and sustain positive behaviors in children, parents and caregivers, and to design patient-friendly health services. When it comes to health, we work hand in hand with WHO to support ministries of health and governments. In the European region, we see vaccine hesitancy increasing, obesity spreading, and an increase in preventable, non-communicable diseases. The work on social and behavioral change is an essential and effective tool to address all these challenges. A good example is immunization, where, together with governments and partners, we track rumors in real time and provide positive messages through online platforms, media, and social media. We gain insight from communities and we mobilize them, changing social norms and expected behaviors. We gain insight from communities. We support demand generation for vaccines, creating opportunities for caregivers to express their concerns and for health workers to engage convincingly with them. We mobilize opinion leaders, influencers, community and religious leaders to build trust in immunization programs. Still, we do not see in all countries a sufficient investment in social and behavioral change, with adequate financial resources and the creation of institutional mechanisms to regularly monitor behaviors and to intervene with evidence-based approaches. In conclusion, we believe that the Regional Action Framework for Behavioral and Cultural Insight for Health is a solid tool that will help us to accelerate progress, and UNICEF is committed to keep supporting governments in this important area of work together with WHO and partners. Thank you.
Thank you very much. I do not have any other international partners on my list. Does anyone want to take the floor at this juncture? I see that is not the case. Therefore, we will move on to non-state actors. I would like to give the floor to the European Public Health Association, who is speaking on behalf of 13 non-state actors. You have the floor. Please go ahead.
The Original Committee. UFA, EuroHealthNet and the 11 co-signatories to this statement welcome the landmark European Regional Action Framework for Behavioral and Cultural Insights for Health. The need for BCIs in disease prevention, health promotion and overcoming health inequalities could hardly be overemphasized. Despite great scientific advancements, the prevalence and socio-economic impacts of NCDs are increasing because the underlying high-risk human behaviors remain poorly addressed within most healthcare systems. Evidence on what influences behaviors at the individual, community and population level can improve the design of health policies and services. Yet, we have been unable to optimally leverage the available and growing relevant expertise. Considering this, we call upon member states and stakeholders to promote and enable the systemic use of behavioral and social sciences in public health and foster the mainstreaming of BCIs in all health-related policies. Advocate the broad use of BCIs as part of policy development, program design, research and communication. Align the use of behavioral and social sciences in public health with increasing uptake of health equity impact assessments. Invest in capacity building of the health workforce to scale up expertise. And commit to working with relevant stakeholders to bridge the gap between research and practice. The potential benefits of BCIs are multiple, as they often bring relatively high return on investment and are scalable and light touch, which is especially relevant within the contexts of overstretched health systems. The challenge now is to move from a general awareness that behavior is pivotal to health outcomes to a working knowledge of what to do about it and how. We, UFA, EuroHealthNet and co-signatories are pledging to accelerate action to utilize BCIs to sustainably improve people's health, equity and well-being. Thank you.
Thank you very much. Would any other non-state actors like to take the floor at this stage?
Je n'en vois pas, donc.
I do not see any requests for the floor, therefore I will wrap up the debate there. Thank you for all of the participants for their comments, for their questions, for their input, and I now turn to the Secretariat for some response and reaction to what we've heard. Rob, you have the floor, please.
Madam Chair, it's been an absolute pleasure to listen to the interventions from the 26 member states that have made interventions, the group interventions, and of course the dozen NSAs in that final statement who are represented, and sister organisation UNICEF. Very grateful indeed. Thank you very much. It's not only did you share a resounding, it's seemingly support for advancing the application of both behavioural and cultural insights of health, but you also shared a remarkable amount of very, very inspiring examples. And we've been busily writing them down and noting them here to build up the repository that many of you will be aware that we've already created. So I can only commend you, of course, or we can only commend you for this remarkable work. A recurrent topic was certainly the opportunity of BCI as a powerful, scientifically founded and cost-effective tool, which must be applied in an integrated manner alongside other public health approaches. The point that you resonated a number of times was this complementarity of BCI to what else is going on within our public health community. A recurrent, another opportunity you stressed to help reduce health inequalities was highlighted by many, applying participatory mechanisms and giving communities a voice, this sense of inclusivity and democracy that was stressed by a number of you. You also highlighted the need for increased cross-sectoral collaboration, including with civil society, which we also felt yesterday and indeed on Sunday when we met the NSAs for a briefing. This was an item and a topic that was of particular interest. So thank you for that. Many of you referred back to the pandemic as a real eye-opener where you began to understand and develop tools for understanding people's behaviors, perceptions and well-being to inform more effective responses. You also highlighted the potential of BCI to help you address these critical challenges, and from 2 or 3 countries at least, in the response to outbreaks and other health emergencies. Several of you stressed the need to focus on both the individual responsibility and the responsibility that we have as governments and international organisations to make healthy behaviours possible, accessible and attractive. And lastly, of course, you called on WHO to facilitate country interaction, to provide that technical support and the normative guidance, and to disseminate evidence and best practice on how behavioural and cultural insights can continue to promote equity and health for all, leaving no one behind. As a social scientist, I might say this is a real milestone for me and for the organisation. We've been advocating for this area of work for, I feel, most of my career, but I know us as a team for a very, very long time. So we really feel that, and I know the team here under Katrine Habasat's leadership, Tina Licky, the rest of the team, please do convey our thanks for the development of the framework and all of the hard work that's gone into the consultations around it. I am immensely grateful, of course, to Iveta as well and to David. David's on his way to the airport at the moment. Iveta, I see you're still in the room. Very grateful for your intervention earlier and for your support, as always. Thank you, Chair.
Merci.
Thank you, Rob. Thank you also to all of your team as well, and thank you for taking into account the comments that have been made. Indeed, this is going to accompany us for some time now, that principle. I would like to record that many non-state actors have shared declarations and videos as well, which you can find on the website. So please do go and check them out, so that you can explore the topic in greater detail. We will now move on to the next agenda item, namely the consideration of the resolution that has been proposed. You can see here on the screen the reference which we are called upon to approve, this resolution that is. And I would like to turn to the regional committee to know whether you can approve the resolution. Are there any objections to the adoption of the resolution or not? I see no objections. Therefore, I declare the resolution to be adopted.
Merci.
Thank you all. The agenda item is therefore concluded. Before we move on to the next agenda item, I would like to turn to our rapporteurs, Mr. Willy Porter, who is going to give us some feedback on the informal consultations that were held at lunchtime. So, Portugal, please.
Chair, yes, the session we have co-chaired by my colleague, Mr. Nitzam Harni, and with the support of the Secretariat, which we'd like to thank, we do suggest to the President to request the Secretariat to prepare and circulate brief procedural texts for draft resolutions on the disabilities and cervical cancer, as well as HIV/AIDS. This would move to brief procedural tests made by the Secretariat. On the other hand, we reflect, and it looks like some of the delegations need some extra time, which it's good to have a good outcome on the local decision text. We hope this is the way forward and can emerge today for these items. We also like to thank for those who were at this informal meeting and their participation. Several member states actually did their own comments, and all of them were noted. And I think we are in a better position than we was before this meeting. Thank you very much, Madam Chair.
Thank you very much to the rapporteur.